So you see, both organisations have got recommendations, the Diabetes UK in their guidelines, which is the whole guidelines for the management and support of people living with diabetes, and the British Dietetic Association, one just on sweeteners. It's about accurate information, so giving people the right information, good facts about sweeteners, so they know the scientific truth and how to tackle the myths, but also then enabling people to make individual personalised choices. So they view sweeteners as stepping stones, a way to reduce sugar and how to enjoy a healthier way of eating. I think we need to remember that low-calorie sweeteners are not a magic bullet. They will not work just by dropping them in our diet. We need to think of what they're replacing and what comes in around across the whole diet. So they're really good if you want to reduce sugar in drinks, so taking sugar out of tea, coffee for example, moving to diet beverages, so you actually from full sugar or part sugar beverages as we have in the UK now, and also in sort of wanting some sweet flavour maybe in some desserts. We need to be careful when we're talking about desserts and puddings, because if we're replacing the sugar in with the sweetener but we've still got a high energy, a high calorie food, that's not good. So we need to look across the whole diet and target that replacement and decide with individuals whether they want to have less sugar but still keep the sweetness. If that's the case, then sweeteners can be a good option. It's based on the evidence. There is not one best diet to help someone living with diabetes or prevent getting diabetes. You know, we've got new research which actually has the option of bringing type 2 diabetes into remission, which is a game changer. And we know for people with type 2 diabetes, most of whom are overweight or obese, losing some weight can help. For type 1 diabetes, it's matching their insulin to the carbohydrates. Beyond that, it's about finding what works for that individual in terms of culture, affordability, taste, enjoyment, so they can actually make dietary changes they can stick with to the long term. That's where dietitians are best placed to work with people living with diabetes to help them to find the right way of eating for them that they can live with and enjoy for the rest of their lives.